Hi, everyone. Let me give you a short summary reflection, my reflection on the prejudiced patient. First of all, I want to thank you all for weighing in on this with the two questions. I have the questions in front of me, along with a very curious dog. Um, so this is an interesting case. It's not very long. It's easy to understand. What we have is a Miss Smith is an African American woman, and Dr. Sims is an African American physician, and he is substituting for Dr. Chen, who, as we also read, has been Miss Smith's physician for 5 years. And so this question, the first question of why is the selection of physicians or any clinician based on race uncomfortable? It's uncomfortable depending on, first of all, it all depends. We don't have, we honor preferences. The American Medical Association and our healthcare system certainly honors preferences in terms of clinicians. Let's just say physicians. When I'm looking right now at sort of two devices here. I'm looking at a picture of all of you, the class picture. Well, it's not really it's your individual USI pictures. And the majority of the class are women. And my guess is that many of you either have an OBGYN, you'll soon be getting one, and for decades, it has been a practice throughout the nation for women to be able to determine if they would like a female physician, a female OBGYN, as opposed to a male. Now, the reality is that's used to be much more challenging. Now it's much easier. Of course, it depends where you live, and it might depend on health insurance and all kinds of things, but that preference is there. We also honor preferences for language as well. If there is a provider that might speak a language of the patient, maybe isn't as fluent, we will go out of our way to honor that, including bringing in certified translators, but a little bit harder to do depending on where you live. In this case, though, Miss Smith seems, especially by her question at the end, to really connect with Dr. Sims in a very short visit. Now, part of it might have to be that he identified a benign skin tag as opposed to a mole, some sort of cancerous mole. It's sort of a positive thing. But partly also she made the comment in the last paragraph about a relationship with Dr. Chen. Now, this has been a 5-year relationship as well. Is there anything wrong with selecting a physician based on race? If it makes what's interesting is there's two answers to that. And I'll tell you sort of an updated answer. One is, to be honest with you, it's not a lot different than the OBGYN example or the language example, partly because everything except the last paragraph was, fairly normal. In fact, even the statement about the accent, which is hard to understand. Now, it was hard to understand. That would be something that my guess, Ms. Smith, hasn't conveyed to Dr. Chen, but it's natural. We have different levels of comprehension, understanding as well. there's actually inherently nothing wrong with it. Now, when she says everywhere you go, there's immigrants, sometimes you just want somebody that looks like you, that's a racist statement. So I wouldn't even say a prejudiced patient, it's a racist patient. And that really causes Dr. Sims to go back, to be taken aback. Apart from, can you be my doctor now? Because that is an acceptable question to ask. There's comfort in that. Now, it doesn't mean that Ms. Smith is going to listen to everything. She has diabetes and become a better diabetic. But she feels more comfortable. She has more trust in the relationship simply because the physician is Black. Now, is that going to help her? It sounds already like it will. Now, there's an issue with the racist statement. So this becomes, it's actually much more common than you would, again, based on where you are. This type of interaction, especially with physicians who are in the minority. When I mean in the minority, let's just cut right to race. It becomes much more prevalent for African-American female physicians because of the small number that exists. And there's an immediate movement towards them from African-American patients. But now, does it mean that individuals' adherence or quality of care increases? Maybe, but maybe not as well. The second question here, what would you advise, Dr. Sims to respond to? I think many of you put down, or let's see, the majority, I'm not going to say many of you, the majority, which is over 50%, would put down that, hey, you're making, Ms. Smith, you're making a racist statement here. And whereas that is absolutely true. What it does is obviously cause, as I've said before, conflict, and might actually, whereas the truth, can be painful. A doctor's office visit is really not the time, and it's not really the purview to stop racism or to fix racism. That's not the time to do it. And so that's, first of all, it was made, about Dr. Chen, who wasn't around to hear it, who isn't around to sort of counter or accept it. So the issue becomes then, should Dr. Sims say yes? I mean, if you want to be my patient. Now, ideally, you have to wait for Dr. Chen to get back from vacation. I'll tell you, this does happen. It happens beyond race. It happens for all kinds of reasons. And I think many of you know that, but people switch physicians or healthcare institutions, or for let's say, clinical reasons, only because of preference. We do the same things in other portions of our lives that involves individuals that we feel closer to. A statement that I have been using, which comes from a training I went to a little while ago, and I'm sort of butchering it, is, I am like you, something, I'm going to mess it up, so I'm not even going to say it. But the idea is that, I connect with you because I like you. And really, if you go a bit further, it's I connect with you because I like you and I'm like you. we sort of gravitate towards those who are like us, who have similar characteristics to us in all kinds of different ways. The last thing I'll say is, because I haven't really written anything on here, is many healthcare institutions now have policies against racist patients. And now that racism extends to sexism, to comments about ethnicity, perhaps comments about sexual orientation, or even faith. And so it's really, and I'm going to try and highlight this, it's this which really is sort of the key thing, right? And now the reality is no one can stop anyone, when we're talking about a patient-physician relationship, from saying something. We can put up signs, we can say, you can't be racist in your appointment, you can't be sexist, but we're not going to be able to control that. And so what can be controlled is our reaction, perhaps if there's a policy. Now, the policy to really say, well, if you're going to if you're going to be racist, now saying something, acting that way is one part of it. But if you're going to be racist, then you're just not going to receive care from that particular provider. Issue, of course, is this, right? In a smaller community, that really becomes hard, because we have Miss Smith here who's diabetes and she's got issues and all kinds of things. So we're not going to fix racism, but we have to be able to manage it in healthcare. This is a topic actually that is, believe it or not, going to, and I'll sort of end on this, apply to all of you. Apply to all of you, whether you are diving into healthcare as a career or not. You will be exposed to it as a patient or a family member. You will be exposed to it as a bystander, or let's say a friend is connected, whether it be, and I'm thinking about all the isms here. Let's go back to the notion of prejudice. All the isms will come back to you, whether it be because of your age, your gender, the fact that you have a tattoo, all kinds of things. Now, this has nothing to do with an individual's skill set or competency. But we also realize that she feels comfortable. She feels really much more comfortable with the African-American physician. Okay, so those are my sort of summary thoughts here. There isn't a perfect answer to the second question, except challenging the patient, Ms. Sims, in the middle of the appointment will cause conflict. Now, that conflict can be, cause her to leave the practice, cause her, and maybe her health will suffer. Maybe it might make someone feel better, but it's not the right time or place. The question then is, when is the right time or place? Otherwise, it'll continue. Okay, folks, I'm going to let you go on this one. Thanks for, again, sharing your thoughts on this case.